Welcome everyone to our weekly chat with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you for joining us again this week.
Hi, thanks for having me.
Thank you so much. My name is Dilshad Burman. I am a web writer and reporter for City News and 680 News, and I will be moderating this chat today. Now, how it goes is we've been asking you for questions all week, and we've got tons of viewer submitted and listener submitted questions that we have collected, and we're going to ask the doctor. If you haven't had a chance to submit your questions, you can do so under this broadcast, and we'll try and get to as many as we can, even if they're coming in live. And if we don't get to them this week, we'll try and get to them next week. So, doctor, are you ready to go?
Yeah, let's go.
All righty, let's start with our viewer submitted questions. We're going to start with some testing questions today, some kind of scientific complicated questions. Let's start with Mo. He asks, how many cycles are being used on the PCR tests in Ontario?
So I think the question here is related to the cycle threshold, and that's a specific marker that we use when we want to determine could this positive test be related to an old infection? Could it be a false positive? Could it be a true positive, for example? And so the cycle threshold cycles, and each lab has their own value that they use to determine what the cutoff is. So the cutoff is usually between 30 and 35, around there, but each lab, depending upon where you get your test done, would have their own determined cutoff.
And is the accuracy of the test affected by that in any way?
It helps to give us a little bit more information if we think that the positive result could be from an old infection compared to a new infection. That's, for example, one way that we use that result.
Okay. And then Dave and IE have a similar question about R numbers. Dave says there have not been any discussions for a long time about the reproduction rate, and why has that information not been made available? And how do the R numbers in Toronto compare to those in Ontario in general?
So the R number is actually one of the numbers that's available on our website. So if you go to our website, go to the statistics page, and there's a monitoring dashboard, and they have an R number there. There's the R naught and the R effective. You can also find the number for Ontario posted on different websites. And what you want to...
Sorry, doctor, we've lost your audio. We're just connecting. Here we go. Oh, and you're on mute.
Sorry. So what you want to see is, what you see is that you want the R number to be below 1. That means that we're not going to get, every new infection will not lead to one other or more people who are infected. And on our website, you can see that the R effective is around 1.1, 1.2 on our website. So you could look at that and find out exactly what that number is week over week.
Okay, so so you said this week we're back to 1.2 or so?
We've been at about the same level for the past couple of weeks, but what we haven't gone is below 1, and that's where we need to be in order to see cases really to start to decline and stay low.
Right, okay. More testing questions. Pat asks, is there a test that can determine whether you had COVID-19 in the early stages, even before it was rampant in Canada, before Canadians knew about it?
There's the antibody test. Again, it's not clear how strong that test is to be able to determine definitively whether you actually really. So, other than that, there isn't really a very good test to be able to differentiate whether or not you had had the infection previously.
Right, and as we've talked about before, even if you were to use an antibody test, which is not really available to the public anyway, what are you going to do with that information? Because there's nothing you can do with it.
Well, even if you knew that you had COVID previously, you're still going to have to keep your precautions to prevent getting another infection because that has occurred.
Yes, absolutely. And then Maria asks, why don't we have rapid tests and at-home tests yet like other countries do?
They haven't been licensed yet in Canada, those at-home kind of, pea on a stick type of a test. We do have more rapid tests that are available, and they are being rolled out in certain ways in our city and in our province. And so that will be coming. You can expect that as the technology gets better, as we get more approvals, that more and more of these testing strategies will be available to more people.
Okay. And then Turk has another question about testing. Can you get a COVID test even if you're not showing symptoms? I want to spend Christmas with my family and grandchildren, and that constitutes 9 people. If they get tested just before Christmas, would that be acceptable? I live on my own and have taken all the safety precautions.
So we're going to have more specific guidance related to the holidays when the holidays come. But I think right now our message is to really stick with your household, the people that you live with, not to gather with other people. That is part of our gray lockdown measures in the city. If you rely on getting a test and the test is negative and now you say, okay, I can go visit my family, or some people are thinking, okay, well, I'll self-isolate for 14 days, I can go visit my family. None of that is 100% accurate. And what we really don't want is people to mix together in groups, because we know that that's the way that's actually gotten us to this place right now where we've had to go back into lockdown because of those gatherings. And so I think we'll provide more guidance to come, but I don't think that there's any safe way right now that we can meet in groups of 9 without that risk.
Right, absolutely. Okay, and then we'll go into sort of a mixed bag of questions coming in here. If we are in lockdown right now, why are schools still running? Asks Sakityan.
So the school story is a very interesting story. And one of the reasons why schools are open is, first of all, because they're safer places to be. While we've had COVID spreading in the community, we've had more cases rising in the community, the cases that have occurred in school by proportion have been smaller. You know, about 7% of all of our cases that have occurred have been related to schools. So despite the fact that there are so many students and staff that are working or attending schools, that number is quite small. We also know that the cases that have occurred in schools, by and large, have gotten COVID from the community, from their homes, from different settings, and that's how it has come into the schools. The people that have actually gotten COVID because they attend school have been a very, very small proportion. And finally, we know that studies have shown that during the lockdown in the spring, when schools were closed, children and students had a lot to lose, and it was difficult for them. They had negative health consequences because of schools being closed. And so there's a really good reason to keep schools open to help children and students, their mental health, their cognitive growth, their behavioral growth, and their education are all very good reasons why we're committed to keeping schools open, as long as they continue to be safer places to attend.
Right. And then we had a related question come in this week regarding schools, because we had talked about it last week in terms of children spreading it to other children. Like you mentioned, most of the kids that are getting it in school are actually catching it out in the community or from other adults. But the question asks, if children, say, are asymptomatic and then they go to school, what about spreading it to the adults in the school, like the teachers, the staff, that kind of thing? Are they more susceptible in that sense because the children are asymptomatic?
Yeah, so we've actually looked at our data in Toronto, and about 30% of the children who have gotten COVID have been asymptomatic. We actually plan on people coming to school contagious, because we know that you can be contagious even if you have symptoms 2 days before you get symptoms. Mm-hmm. But that's why we have so many public health measures in place, so that even if you come to school contagious, the likelihood of you spreading it in the school is smaller because of those public health measures. And I think that that's what we're finding. The staff who work in schools are wearing PPE. And so we know that if you wear PPE, if you're exposed to someone who's contagious, the likelihood of you getting it is very small. And as well, for the students who are in classes with someone who may be contagious, all of the other measures, wearing a mask, staying home if you're sick, washing hands, all of those other measures are helping to prevent the spread within the classroom as well.
Right. Actually, we have a live question coming in here. Let's take this one. Lindsay asks, if you get reinfected with COVID, how is a vaccine going to help that?
So we're going to have to determine whether a vaccine will help with reinfection. Can you get the vaccine if you previously have COVID? What if you get vaccinated and it protects, will it protect against all of COVID infections? These are all really good questions that we're going to have to wait to see the results of the studies to be able to answer. Now, some of the questions we won't actually have answers for when a vaccine is considered safe and effective to use. For example, we won't know how long the vaccine is going to last. You'll only know that when years have gone by after having provided the vaccine, for example. But the real goal is to find out, does the vaccine work and is it safe? And once we have those answers and can look at those studies, we'll be able to make some more determinations.
Right. So, doctor, you just mentioned right now, can you take the vaccine if you've already had COVID? We don't have that answer yet.
We don't have that answer yet. We don't know who, when the vaccine gets licensed, who will it be licensed to? And, whether that will be a contraindication or not, it's not clear right now.
Okay. All right. Let's move on to a couple more submitted questions here. More school questions. Mariam asks, 2 students at my school are infected. The affected classes are isolated for 14 days, and public health does not require a test for the students in the affected classes, nor are they recommending that siblings of infected classes be tested or isolated. So what if the siblings attending the school are asymptomatic carriers, and shouldn't any student who comes into contact with a known case be required to get a test?
So everyone who comes into so if there's a student in a class who has COVID, the whole class, the whole cohort will be sent home because they're considered a close contact. And if you're considered a close contact of someone who had COVID, you will be recommended for testing, actually. So if you were a student in that classroom, you are home now, you're a close contact, you're recommended for testing. Your siblings, though, who live in your household, they can still attend school because they did not have contact with the person who was positive. If, however, the person who's at home isolating gets symptoms, now the siblings have had contact with the person at home and are required to stay home.
Right. Okay. So I think we had talked about this before. It's the levels of contact. Are you a close contact, medium contact, or not considered a close contact at all?
Yeah, that's right.
Okay. Let's see. Ali asks, when a school has staffing coming to work from 5 different places, within the GTA, like Toronto, Peel, York, Simcoe, etc., what is the best way to stay safe in a small school of about 30 staff total? Because they're going between zones.
Yeah, so I mean, the public health precautions that are in place in schools, including the occupational health and safety measures that are in place, like wearing PPE, will protect staff and students regardless of what zone they're coming from. And so it will ensure that the school can continue to be protected regardless of where you're coming. But when you enter the school, if you have symptoms, you shouldn't go. You should follow the physical distancing, like all of those things to help prevent that spread in that school.
Right. Okay. So now Adi asks, some areas in Toronto Public Health have a growing positivity rate of 10+%. What and how is TPH planning to contain the spread in those areas?
So we have been working closely with some of those neighborhoods that have the higher, it's called percent positivity. We look at that number. We also look at the rate of cases that are occurring in those neighborhoods. And we have community outreach workers that have been working with some of those neighborhoods to help address some of that. We want to make sure actually that there's a high enough testing. A 10% positivity rate when not a lot of people are getting tested may not be a true indication of what's going on in that community. But we're certainly working with community groups to increase testing, have access to talk about the public health measures, to see if there are particular needs that need to be met, to even talk about our voluntary isolation center so that people know that if they can't safely self-isolate in their home, there are other options that are available in our city.
Actually, doctor, can we talk about that? The voluntary isolation centers, how many are there in Toronto?
We have one that's in the city that's available. It's there is criteria that has to be met to be able to go there. And so when we do our case investigation, if the person who has COVID can't safely isolate from the other people in their household, they could be eligible to go. Or if you have someone who has been identified as a close contact and they can't safely isolate in their home, that they could also be considered if they're eligible to go to the voluntary isolation center.
Okay. This is an interesting one because we've got a lot of questions about big businesses versus small businesses in the lockdown currently. Heather asks, why isn't there more contact tracing happening at big box stores like Costco and Walmart? Because restaurants and gyms had to do it. It appears the little guy keeps taking the hits while multi-million-dollar businesses have little to no consequences.
So in retail places that are open, they're required to follow strict public health measures. And we certainly have public health inspectors, enforcement officers that go out when we receive complaints if there are concerns for things like crowding, capacity. In the new gray lockdown measures, there are new measures that are in place for those stores that continue to be open. For example, they can only have 50% of their capacity. They have to have a safety plan in place. So there are a number of additional measures that they do have to follow. I think for the public who are using, who are shopping, you have to be aware that you have to assume that everywhere you go, anyone you have contact with could have COVID. And that's why you have to be able to take your measures. Keep that 6 feet at all times, wear that mask, because you want to always assume that someone could be contagious, and you don't want to be in a position where you're in close contact that you could get infected. So it's on both ends that we have to watch our measures.
Right. And then we have another question coming in live, similar related to small and big businesses. Tracy asks, why are small businesses forced to close, but the Brampton Chrysler plant is open? There's 3,000 people that work side by side like sardines, and it is the highest area of Peel with most of the cases.
Yeah, so I think if our viewers have questions about the measures in the lockdown, they are provincial measures, and so you can definitely reach out to your provincial counterparts to ask some of those specific questions. We are certainly following the guidelines. They are provincial guidelines. Essential workplaces are allowed to open, but again, essential workplaces can only open, they have to follow those public health measures. We have to make sure that if you're going to work as an essential worker, that we're not in a position where COVID is going to spread a lot in those places. And so workplaces do have a very big role to prevent the spread of COVID.
Right. Okay, let's move on to some of these more questions about meeting and interacting. EB asks, can children have play dates which are indoors with friends from outside their family circle if they keep the numbers to 10 or less? And should they also wear masks, maintain 6 feet distance, things like that?
In the current gray lockdown, you cannot have play dates. That is not allowed. It very clearly says that you can have indoor gathering with the people that you live with only. The only gatherings that are allowed are outdoors, up to 10 people, keeping a physical distance. And the only other gathering that's allowed is for a wedding, a funeral, or a religious rite or ceremony. And that is capped at 10 people in the place of worship.
Right. This is one that we haven't had before. Ken asks, cannabis seems to help a lot of things in life. Can it not be used for COVID? He says it may be a silly question, but worth submitting.
Yeah, I mean, I think we're trying to find out what can work to prevent COVID or to treat COVID. I'm not aware of any studies that have shown that cannabis can either prevent or treat COVID. But I'm certainly keeping my eye out for, what the science is showing.
Okay. Okay, let's do some mixed bag questions here. Sam asks, how do I know if I have COVID or the flu?
Well, sorry about that. So it's actually very difficult to tell the difference between COVID and the flu because the symptoms can be quite similar. And if you just rely on the symptoms, you may not get it right. And so the best way to determine the difference between COVID and the flu is actually to get tested. If you have even one symptom, even a mild symptom or a severe symptom, many symptoms, get tested. That's the best way to differentiate this.
Okay. And this one, in the middle of the second wave, Alan asks, do you think there's going to be a third wave?
There could be, yes. I mean, you know, we're in the middle of a pandemic. We've seen wave one, and now we're into the middle of wave two. You can expect that there might be a wave three. I think until we have high herd immunity levels, until we can consistently keep our public health measures and precautions in place, the virus will spread. I mean, we've seen that in other parts of the world where they've gotten a hold of the virus and then it continues to come back. So, you know, until we can get those herd immunity levels high, we have to constantly be aware of this virus and what we can do to prevent it.
Right. I guess we kind of covered this, but I'll just ask it anyway, because we had this last week as well. Bob asks, if you're currently fighting coronavirus, will a vaccine work just as well as a vaccine administered prior to being infected?
Yeah, so we're going to have to wait for the studies and when the vaccine is licensed to see what it says about people who have previously had the infection and whether they're able to get the vaccine. Certainly there are other vaccines where if you've had the infection, you can still receive the vaccine and that's safe. Some of the question is about safety. Is it safe for you to get the vaccine? And the other question is about, well, will the vaccine actually work to protect you against another infection?
Right. And then if you're currently sick, that you can't, can you get a vaccine when you're already fighting a certain, like whether it's flu or whether it's coronavirus?
We often don't give the vaccine for people who have current symptoms. And part of that is because if you get sicker, we won't know if it was the infection that got you sicker, was it the vaccine that got you sicker? Also, when you're sick, you may not mount the best immune response to the vaccine. And we certainly want to get the best immune response that we can get.
Right, absolutely. Another Bob actually asks, is there any proof that these extra restrictions are actually helping, or is it just so that they can say, you know, we took the extra measures and they can't be accused of not doing anything?
We've seen in parts of the world, like in Europe, they've had different countries have had different types of restrictions. And you've seen that the restrictions have resulted in reducing cases of COVID. Depending upon the type of restrictions, they've either had more or less benefit in their population. The more strict restrictions, they may have had better outcomes. It's certainly something that we're keeping an eye on here in the city to see whether our case numbers are showing improvement. We're keeping a very close eye on that.
Right. So then Dick, I guess, has a related question. He says, why are you not backing off on the restrictions now that we know that the death rate for COVID-19 is below 0.5%?
Part of implementing more restrictions now is because COVID was increasing in the long-term care homes. And we saw in the spring that when COVID really hit the long-term care homes, we ended up with many, many deaths. And as you have more community transmission, you will have more cases that will come into these institutions, like a long-term care home. And so part of the reason for the restrictions now, we know that if you implement the restrictions earlier, if you wait too long, the restrictions actually will have less impact. Right. And so if you implement the restrictions at a good time, you can actually make an impact to prevent many of those deaths that we saw occurred in the first wave.
Right. And I think we've spoken about this so often. Just because, you know, a person doesn't die of the virus doesn't mean there aren't really bad effects of the virus. We've talked about COVID long haulers and people seeing effects, you know, months and months after they've been infected. So you don't really want to risk catching it at all.
Yes, exactly. And if you're young and healthy, you can't guarantee that you're going to be able to get over it, because we've seen that some young and healthy people do have a more severe illness.
Right, right. Okay, let's see. Ruse asks, what are the actual infection rates, cases, what is basically the difference between cases and infections without confirmation?
So cases can be defined as a confirmed case, and that's someone who is laboratory confirmed. They have a positive lab result that shows that they've got COVID. We also have a category called probable cases. And so these are people who, for example, in a household, 2 people have COVID, there's 3 other people in the household, they have been in close contact, now they develop symptoms. Some of those people choose not to get tested, but because they've been living in the house with 2 other people who have COVID, and then they develop symptoms a few days later, we call those probable cases. And so they may never go and get tested, but there's good epidemiologic evidence that they have COVID, and so we count them as cases. And so that's the differentiation there.
Okay, so when we say cases, we're talking about lab confirmed positive cases. We're not just talking about.
Toronto, we count confirmed and probable cases. Provincially, they count only the lab confirmed cases.
Right. Okay. And on our website, on the Toronto Public Health website, I believe that there is a differentiation between probable and confirmed, correct?
That's right. So you can determine how many meet each classification. That's right.
Right. Okay. Okay, let's move on to this one. Valerie asks, I have 2 caregivers coming into the house every day to care for a 93-year-old. There are 5 caregivers in the team total, and about 60% of the time. She's worried that this might not be safe.
So first of all, to say that healthcare is still allowed during COVID, and if you need personal supports from people, that is still allowed. So I want to say that in the gray lockdown. I think there's no question that we have to make sure that the workers are taking precautions so that they don't bring COVID into the home for your loved one. And so making sure that they're wearing their PPE as required and all the time and properly is going to be really important. And asking them to make sure that if they're sick, that they don't come. Those are some of the measures that you can take to make sure that your loved one is getting the care they need, but in a safe way.
Right, absolutely. Andrew asks, is there microdata available on who is getting the virus and where?
You can go to our website and we have a map that shows where people live who have COVID. It doesn't mean that that's where they got it. And I think that's an important distinguishing factor. We also have some information on what's the most likely source where they get the infection. 50 to 60% still say that they get it from someone who they know it had COVID and they were a close contact from them. And then the other common ways that are identified are through healthcare, through travel, and then a number are still getting it in the community where they've been out and about and we can't quite pinpoint where they got COVID.
Right.
Yeah.
Okay, and then, okay, we have 2 minutes. Lily asks, with the current COVID-19 situation, why aren't dentists and dental hygienist clinics shut down? Is it an essential service like other medical services, because there's no social distancing possible with dentists?
So dentists are allowed to stay open. They are considered an essential service. If you have a dental emergency, it is essential that you get seen. They do have precautions that they're required to take, PPE that they're required to take to ensure that they're providing care in a very safe way.
Right. Let's see. Guy asks, last question. In your expert opinion, how can Canadians put faith in vaccines without the years of data collection needed to verify the safety and their future health without proven data facts on long-term health issues or possible side effects of the vaccine?
So, I mean, we won't have the long-term side effects of the vaccine available when the vaccine is ready to be given. It's always a matter of informed consent and balancing the benefits and the risks. And we know, for example, that some people in our society are at very high risk of getting COVID. And if they get COVID, they could get very severely ill and even die from it. And so it's about balancing what we know with what we don't know and what the risks currently are with what the risks could be down the line when anyone makes an informed choice to get vaccinated.
Right, absolutely. And with that, we are at 1 p.m. Thank you, doctor, for again taking the time and all your patience in answering all of these questions that come in every week. And thank you to everybody that joined in and sent your questions in live. If you have more questions, you can continue to submit. We'll ask the doctor next week. Thank you, doctor.
Okay, bye.
Alrighty, bye-bye.